Ever feel like you're doing all the right things and still wondering why your body feels off? You eat well, you train hard, your labs say you're fine, but deep down you know something's slipping. You're not alone and you're not crazy. I'm Daniel Rasmussen, founder of Echelon Center for Longevity, and I've spent 2 decades helping high performers like you to reverse aging, reignite vitality, and finally get answers. On Unbreakable Vitality, we go upstream. We talk peptides, stem cells, precision diagnostic testing, reversing the age of your arteries, all the innovative science-based tools to take back your health span so that your next decades are your best yet. Because aging is real, but decline is optional. Welcome back to Unbreakable Vitality. In today's episode, I'm excited to share this with you, is our part 2 at our look at Retatrutide. This is a powerful new triple agonist peptide that's getting attention for its metabolic effects. But we're shifting focus. That was last week. This week, we're shifting focus from weight loss to joint regeneration. Why is that? Because emerging data from the TRIUMPH-4 trial suggests that Retatrutide may have the potential to not just reduce body fat, but to slow the progression of knee osteoarthritis and even improve joint structure. This has massive implications for anyone battling degenerative joint disease, chronic inflammation, and mobility loss. As a quick reminder, at the Ageless Future Longevity Summit, we cover cutting-edge use of peptides like Retatrutide. It's not just for weight, but for structural and inflammatory repair. Apply at agelessfutureseattle.com and check us out. Check out our longevity summit. See if you want to come. Our medical team is incredible. So let's get into the data on this study. So why osteoarthritis is a longevity problem? Knee OA or knee osteoarthritis isn't just a mobility issue. It's a health span killer. It limits your movement. It increases inflammation. It decreases your VO2 max and often leads to depression, isolation, and metabolic decline. In fact, joint pain is one of the top reasons clients at Ageless Future say they feel old. Traditional treatments include non-steroidal anti-inflammatory drugs with long-term gut and liver risk. Then you've got cortisone injections. Some docs are doing PRP. Don't recommend PRP inside a joint. You can do hyaluronic acid to temporarily lubricate the joint. And then you've got surgery. We do a lot of regenerative medicine, stem cells, alpha-2 macroglobulin, but a lot of the cortisone and the things like the NSAIDs, the oral NSAIDs, steroids, they don't address the underlying drivers, which are systemic inflammation, visceral fat burden, and cartilage degeneration. So this is where the TRIUMPH-4 trial caught our attention. TRIUMPH-4 is a multi-phase, ongoing randomized trial exploring the use of Retatrutide in patients with obesity and symptomatic knee arthritis. The researchers are examining pain and function scores, the WOMAC scale, inflammatory biomarkers, structural joint changes via MRI. Initial findings have shown significant reductions in pain, improved joint function, reduction in weight load on the joints, lowered systemic inflammatory markers like CRP and interleukin-6, and most importantly, MRI data suggests less cartilage degeneration over time, possibly due to both mechanical unloading as well as systemic inflammation reduction. So this isn't just symptom relief like an NSAID, it may be disease modification. So while Retatrutide isn't yet FDA approved for osteoarthritis, we're watching closely and preparing for what's next. In the meantime, here's what we are doing using weight loss peptides like semaglutide, tirzepatide in OA patients with metabolic dysfunction. Combining these with GHK-Copper, BPC-157, and TB-500 for joint healing, along with our intra-articular joint injections with the umbilical-based placenta perinatal tissue stem cells, otherwise known as Wharton's jelly. So adding mitochondrial and stem cell therapy to improve and recovery, we monitor things like the WOMAC scale, pain and mobility, your gait and balance assessments, looking at inflammation markers on the bio blood panels. We're looking at structural scans when appropriate. And patients who lose visceral fat and reduce systemic inflammation and restoration often experience better movement, less pain, lower need for surgical intervention. So this opens up a whole new frontier. Metabolic peptides as orthopedic interventions. It's phenomenal. So are there any risks? Is there any hype? And what does the road ahead look like? Well, as with all emerging therapies, we need to balance enthusiasm with data. So potential concerns with Retatrutide could be, GI effects, nausea, delayed gastric emptying, things like that. Appetite suppression that may reduce protein intake. You got to really be diligent about your protein intake. And you could have some muscle loss if not paired with resistance training to maintain that muscle loss. At Ageless Future, we approach all peptides with pre-cycle labs. We do joint risk assessments, and we do lifestyle architecture, lifestyle pairing, protein intake, training, and sleep. We're not saying Retatrutide will regenerate your knees overnight. We're not making any claims like that. But combined with regenerative medicine, movement training, and peptide stacking, it may become a powerful adjunct to keep you walking strong up until your 80s and beyond. I know that's how I plan to do it. So if you or someone you know that you love is facing joint degeneration, there's hope. There's other options besides just managing the pain as it gets worse. Retatrutide and other peptide-based protocols may soon redefine how we treat osteoarthritis. So why don't you come and learn about this state-of-the-art information at our next live Ageless Future Longevity Summit here in Seattle to learn how we are combining movement, mitochondria, and metabolic upgrades to preserve your joints for decades to come. Make your next decade your best decade. Apply now at agelessfutureseattle.com, and I'll see you next time.
If you're feeling like your energy, your edge, or your clarity just isn't what it used to be, you're not alone. But you're also not stuck. Every week on Unbreakable Vitality, we explore real strategies to reverse aging, reclaim vitality, and rewrite what's possible. If today's episode gave you even one insight, pass it on. Then go take the free vascular age quiz at echelon-longevity.com/quiz to see how your body's aging. Subscribe, leave a review, and follow us because your future isn't on autopilot. You are building it and you're just getting started.